Good evening, and what a blessing it is to be with you again this evening. Hi, I'm Dr. Melissa, the Medicine Woman. It's an honor for me to be here with you tonight. And tonight we're going to talk about, ouch, those leg cramps, Charlie horses, muscle spasms. Whew, they are so bothersome to so many people. And if you've never had one, I want you to commend yourself. If you've had one, you know exactly what I'm talking about. So that's what we're going to talk about tonight is leg cramps, how to prevent them, what you can do about them. Sometimes they are so very, very painful that you are jumping out of bed, you're running up and down, you're doing anything you can to get rid of them. So let's talk about what is the best way to get rid of them tonight. But first, as you know, I do have a disclaimer to read for you. So let me just go through this. This show and all the content are for educational purposes only, not intended to diagnose, treat, cure, or prevent any disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your pharmacist, physician, or other qualified healthcare provider about your medical conditions and before starting or using any dietary supplement, herbal remedy, exercise, or nutrition plan. Well, what gives me the right to come and talk to you this evening? So I am the medicine woman. I am the medication expert. I have over 26 years in medication, both Eastern and Western medication. There's a time and a place for both Eastern and Western medication. Supplementation, one of my specialties. I have over 52,000 clinical hours helping thousands and thousands of patients to optimize their health, their medications, eliminate those unnecessary ones, getting to the root cause so that we can only treat what is necessary instead of just continuing to pile on medication or supplement to treat those symptoms. My physician friends call me de-prescriber because I do get rid of those unnecessary medications and supplements. And I am your concierge consultant pharmacist, the medication expert, the medicine woman. And so tonight we are going to talk about those leg cramps or Charlie horses. And I wanted to talk to you about them tonight because there's so many people are affected with these, especially it tends to run that studies have shown that over half of adults over the age of 50 have experienced these painful leg cramps, muscle spasms in their legs, Charlie horses, however you want to call them. They are painful and they can come out of nowhere. They just come out of nowhere. So it is sudden muscle tightness, typically in your calf, sometimes in your toes. I have had them in my toe where it will just come and it's a muscle spasm in my toe and it's just very, very painful. And my toe doesn't go anywhere. It just stays so stiff. And it's very painful. So we want to be able to make these go away. We want to be able to prevent these because so many people, actually about 20% of the people who have nightly leg cramps have moderate to severe symptoms that require them to be treated with medication. And we're going to talk about the medications that can cause these cramps. We're going to talk about some medication or supplementation that you can use to help treat and prevent these leg cramps or Charlie horses. And we're going to talk about some alternative ways as well. So when you get that cramp and you get that tightness in your calf, your toe, I've actually had a Charlie horse in my side before. And that's very, very painful. You get a little sudden muscle spasm, and that's the cramping. So what can you do to prevent these, especially those in your legs? You can do some stretching, okay? So if you stretch the affected muscle, then that is very helpful because it helps to relieve the cramping. So sometimes you can massage the area and that will help make it go away. Sometimes you need to do something like a sports drink because it's often an electrolyte imbalance. And so I say a sports drink because you could get water that has electrolytes in it, but we don't always know if it's specific to a certain electrolyte without you getting some lab work done. And so we can help you with that if you need to get some lab work done and find out, do you have an imbalance? Do we need to supplement with other vitamins to make sure that your levels are appropriate? Are you taking something that's depleting your vitamins out of your system? So let's talk in the detail. What causes these cramps? Okay. So we have done tests in laboratories to determine why you're having these leg cramps. And there's very few reasons why they happen, especially at night. Okay. So when we come across this, now I've had Charlie horses in the middle of the day. I've had them in the middle of the night. They've woken me up before. And so when we're talking about this, we're going to talk about some of the things that can wake you up in the middle of the night and why they happen at nighttime. You might know that they tend to be hereditary. So somebody in your family may have had this, and then you might get this. So is it a genetic predisposition? Well, I don't know. So muscle fatigue or certain types of nerve dysfunction can contribute to the leg pain. And leg pain then can, because your muscles are fatigued, they can go into a sudden spasm. And that sudden spasm, of course, is that Charlie horse or that muscle spasm. Now, we talked a little bit earlier about electrolyte imbalances. Now, and then I said the sports drinks could be beneficial. So sometimes if you have those cramps, those muscle spasms, Charlie horses, and you jump up and get in the middle of the night, if you're able to go and drink a sports drink that has those electrolytes in it, or some water that has the electrolytes in it, that can often alleviate the pain right away. Now, some people swear by pickle juice or mustard. Now, I can't find any conclusive studies on that, but I do know people who will take a tablespoon of mustard and that will make their cramps go away, or pickle juice. So we're just going to consider them alternatives, and they may work for you. I don't have any good conclusive studies on them though. What I do know is that the electrolyte imbalances, so potassium, magnesium, and calcium, are often altered, and these can cause those muscle spasms to happen. Now, the biggest one is the magnesium, and we'll talk more about that later. But to know if your levels are off, we really do need to do some blood work, and we need to do some in-depth blood work and find out what your magnesium level is, what's your potassium level, what's your calcium level. Is the change in your electrolytes that's causing you to have these leg cramps, especially at night? Is it on top of already muscle fatigue because you've already been and you've overworked those legs or those muscles, being up on them all day or running or whatever? So that's a possibility. Now, the other possibility is that certain disease states can actually cause you to have cramps. So diseases of the blood vessels, especially like vascular diseases, if you have varicose veins, spider veins, that could put you at risk for developing Charlie horses or muscle spasms. Now, cirrhosis puts you at higher risk for having these spasms, as well as does pregnancy. Okay. Now, some medications have a side effect. Yes, an adverse drug reaction, a side effect that can cause you to have those leg cramps. And we're going to talk about specific medications that have been proven to have these side effects. Now, it doesn't mean that these medications aren't the most appropriate for you for the condition that you're treating. It may not be anymore. It may be. We may have to figure out, okay, so are you having these muscle spasms and you're taking one of these medications? Can we go back and we look and determine the root cause? Is it that medication causing the problem? Then yes, let's fix that medication. Let's not just pile more medications on top of you. Let's change the medication. Let's eliminate the medication if we can, so that we're getting rid of the problem. So let's start with one of the classes of medications called statins, cholesterol lowering medications. So statins like Lipitor, atorvastatin, simvastatin, Zocor, or rosuvastatin, Crestor. Those are the top 3 statins you've probably heard of. Now, statins can cause some muscle cramping on their own, okay? Now, this could be genetic. It could be because of the calcium leakage that happens with these muscle spasms. It could be because of the pathway that these statins are metabolized by. And if your body's not able to metabolize them correctly, then more ends up in the bloodstream, which then causes the muscle pain. Spasms can cause to serious other problems besides just muscle pain and spasms. Now, genetics plays a role. Coenzyme Q10. Now, you've heard of that, coenzyme Q10. Coenzyme Q10 is it's an enzyme that's in your system. We have supplements to help supplement it. But that enzyme, it helps our cells and muscles produce energy. And what happens is that statins, when you're taking a statin, they lower the amount of CoQ10 that is in your system. And so it is recommended that if you are taking a statin medication, such as atorvastatin, simvastatin, rosuvastatin, that we also give you CoQ10. Now, of course, when you're taking a supplementation, we always want to make sure that you're taking good, high quality supplementation, knowing where it's sourced, that you're not just throwing your money away. Don't just get it at the big box store just because you got it for $9 and you got 1,000 pills. It's probably not the best medication or supplement for you. So when we look at that, the CoQ10, the least amount of, when you have less CoQ10, that can result in muscle pain and spasms, because as I said, that enzyme helps our cells and our muscles produce energy. Okay. And when we don't have that, then we have a problem where our muscles can cause pain. Okay. Because we're not getting the right amount of CoQ10 if the statin has depleted it. So that can cause the muscle pain, the muscle spasms. Okay. So that's one of the big ones you've probably heard of. So if you are experiencing Charlie horses, muscle spasms, muscle pain, and you are taking a statin medication, then let's chat and find out, is that the cause of your muscle pain or weakness or spasm, or is there something else? It could be something else. It could be another medication. It could be a lack of electrolyte imbalances. So let's have a chat and figure out what is the actual cause of that. Now, potassium sparing diuretics. So there's a couple of them out there. Triamterene, spironolactone are 2 of the most common potassium sparing diuretics. And what that means is that those diuretics don't pull the potassium out of your system. So other diuretics like Lasix or furosemide and bumetanide or Bumax or torsemide, they actually pull potassium out along with the water. So when they're pulling out the water to pull the fluid off, they actually pull potassium out as well. And so we usually have to replace the potassium. Now, these potassium sparing diuretics, they do not pull the potassium out, because that's what they're called, potassium sparing. And so what happens is that you can actually have a fluid build up. Okay. And those the diuretics that are pulling off this fluid, these can actually cause the leg cramping because the electrolyte level changes. So it could be that your potassium level is too high or too low. You could have an imbalance depending on what all you're taking there, because a lot of medications can affect your potassium. And though these diuretics, they help your kidneys get rid of the fluid, but they change the amount of sodium and chloride in your system and the potassium. Okay, so even though they're called potassium sparing, it still changes the amount of potassium. So the potassium that's crossed from one side, from inside the cell to outside the cell, the sodium, the chloride. The way that the medication works is it pulls and it changes those electrolytes. And by changing those electrolytes can cause an imbalance, okay? And sometimes they stay in the kidneys, sometimes they go into the urine. So whether or not they're in the cell or out of the cell, and that can cause a problem. So that could be a potential cause of your muscle spasms or leg cramps. Okay. Now, thiazide diuretics. So chlorothiazide and hydrochlorothiazide. Now, these medications are thought also to contribute to potentially these leg cramps or muscle spasms because of the electrolyte changes as well. There is some change because they're a different class of diuretic. They're still pulling the fluid off. They're changing that sodium, potassium chloride ratio. And so that's a potential for an imbalance. And an imbalance then can cause a muscle spasm. Okay. So those are the big ones. Those medications, the diuretic medications, are used to treat edema. So we want to pull the fluid off. Okay, so when you have too much fluid, whether it be in your legs, your ankles, maybe it be around your heart, we're trying to pull the fluid away so that your organs can function properly. But when we do that, sometimes we come to an imbalance of those electrolytes. So that could cause those spasms. Now, iron. Iron has been shown that people who receive iron sucrose, especially Venofer, which is usually given, it's an IV iron, so you don't take it orally. You get it in the hospital or as an outpatient. It's used to treat anemia. So if you're anemic, so you don't have enough iron, you may have gone through an iron infusion and you probably received iron sucrose. Well, the iron, this iron has been shown that it can cause to have leg cramps. It's actually, the studies show that 23% of people receiving this iron will develop leg cramps at night. That's a pretty high number. 23%, that's almost a quarter of the percent of people who take this medication. Now, another medication, estrogens, or especially conjugated estrogens like Premarin, which is used to treat conditions like hot flashes, osteoporosis, even breast cancer. It is estimated that 14% of people who take conjugated estrogens may develop leg cramps. Okay, so this again, it's an imbalance, and it's been shown that this particular medication, while it's helping with these other conditions, could be causing leg cramps. And so we need to figure out, okay, what's the risk benefit? Do we give you this medication and give you something else to treat the leg cramps? Or do we switch the medication to treat your hot flashes or your breast cancer that doesn't have the effect of causing the leg cramps? That's what I like to do. I like to get rid of versus just adding more, because it doesn't make sense to keep adding. So when you end up with a boatload of pills and you don't need to be taking all of those pills. So the other medication that has been shown to cause leg cramps is Evista or raloxifene. Now, raloxifene is a medication used to treat breast cancer. Okay, it's to help let me rephrase that. It's a medication used to help to treat and prevent osteoporosis and complications from breast cancer. Okay, so they've relabeled it just a little bit, but up to 12% of people taking the raloxifene may develop leg cramps. So that's a pretty good size number. I mean, 12% doesn't sound big, but that's still a good size number. And if you happen to be one of those 12%, that can be very painful. So there's other medications that have been shown to cause leg cramps. Now, these are shown about 3% of the time. And so I'll just go through the list that we have here. Wellbutrin or bupropion, Celebrex or celecoxib, Zyrtec or cetirizine, that's used for allergies, fluoxetine or Prozac, that's an antidepressant medication, naproxen, Aleve or naproxen, that's an anti-inflammatory medication, Lyrica or pregabalin, sertraline or Zoloft, short-acting inhalers such as a Combivent inhaler or a Xopenex inhaler, the levoalbuterol, have been shown to have leg cramps possibility, as well as Ambien or Zolpidem. Now, in the studies, that was a 3% chance of getting a leg cramp, but still 3%. If you happen to be one of those, then it's going to be painful for you. So we want to make sure that you know the reason behind those. So I wanted you to go through, and if you're taking any of these medications, then let's chat. Let's find out if we can get you off of them. If you're having these leg cramps, let's make sure that we can eliminate them for you, because I don't want you having these painful leg cramps. Now, there's other conditions as well. So we talked a little bit, and we talked about the medications. Now let's talk about some conditions that can put you at increased risk of developing these leg cramps. Now, these conditions could be things like the spider veins we talked about, varicose veins. High blood pressure can put you at risk of developing leg cramps. Kidney disease or kidney problems. If you have metabolic conditions like hypothyroidism or diabetes, then there is a small link to showing that you could potentially have these leg cramps or spasms. As I said, 50% of people over the age of 50 have experienced leg cramps, muscle spasms, Charlie horses, all the same thing. Painful. Pregnancy can put you at increased risk. And of course, chronic alcohol use, because it changes the chemical structure that alcohol does. And so those cramps can happen. All right, so we've talked about the fluid imbalance. So we want to make sure that we check your electrolytes. Let's see where your electrolytes are. Do you have the right amount of potassium in your system, the right amount of magnesium, the right amount of calcium? These all play a huge role in regulation. So you need a certain amount of calcium, potassium, magnesium, sodium, chloride in your body. Okay. And when it functions properly, when you have the right amount in the cells versus the right amount in the bloodstream, then your body's functioning properly and you're not having any issues. But if you happen to have more in one area than another, then that's when we can see problems. So we also see that people who stand for a very long time, once they do, especially on hard surfaces, once they do sit down or go to bed, they can have these leg cramps or these Charlie horses, and they often will keep them up. I have a gal who she ends up half the night because of these leg cramps, Charlie horses that she's having. So we've put her on some supplements to help her, and they are helping. She says that she's getting more sleep now, so that is beneficial. Still working to see if we can eliminate them altogether. But of course, we want to get rid of them. Okay, so check your labs, see if you have an imbalance. Do we need to backfill with potassium, sodium, magnesium, calcium? Let's get that straight. Okay, and then do we need to add something else? Do we need to add things? So I mentioned pickle juice and mustard have been used, and it does that. So if you think about it, the pickle juice has a high sodium content. Mustard has some sodium in there and some potassium. And so that could be the benefit of using those two things to help get rid of those cramps right away. Okay. It's because of an electrolyte imbalance. Now, some supplements that have been shown to be beneficial, magnesium, big, huge one, magnesium, has been helpful to help eliminate those leg cramps, those muscle spasms. Calcium channel blocker. So this is a prescription medication, such as diltiazem or verapamil. There is some limited, but I wanted to mention it, limited evidence that these medications can help with leg cramps at night. Now, if you happen to have another condition where these medications might be appropriate for you, and you happen to be taking something else, then let's switch you to these medications. Okay. Now, B complex, there is some evidence out there that B complex can help reduce the frequency and the duration of those leg cramps at night. Now, of course, when we talk about supplementation, as before, good quality supplementation is what you need. If you need good quality supplementation, let's chat. Reach out to me. Let's check out my website. I have a link. You can go in and order good quality supplementation. You don't even have to talk to me. Something that is very beneficial for you, not hugely expensive, but it is good quality. We know you're getting good quality and you're getting your money's worth. You're not just throwing your money down the drain. Now, another medication that has been shown to have some evidence of relieving the leg cramps is gabapentin. Now, gabapentin or Neurontin has been around for a while. It is a medication that helps with pain, helps with several different things. It was actually marketed initially for something else, but we use it mostly for pain these days. And so it makes sense that it would have some help relieving those muscle spasms or Charlie horses or leg cramps at night. Okay. Now, there is a medication you may have seen, well, quinine. So quinine was a medication used to treat malaria. And a lot of people used to use quinine to help with leg cramps. And the quinine was beneficial. However, the FDA has pulled it and has recommended that you do not use quinine. That has been pulled back all the way since 2010. And that is because there's detrimental effects to the quinine. The risk of the side effects so severe that you do not want to use quinine. Okay, so let's talk about what you can do that doesn't cost you anything. You can do some exercise. That's right. So certain exercises. So if you get up, you have those Charlie horses, sometimes it's get up and you walk around. So maybe you need to get up, you massage your calf or wherever your Charlie horse is, and maybe you do a little bit of walking around. Walking around can help relieve that muscle tightness and help relieve that pain. Stretching the area. So even stretching before you go to bed can be beneficial. Sometimes you need to apply heat to the area. So if you don't have any aversion to heat, then a small heating pad can be applied for 10 to 15 minutes. Do not put it directly on your skin. Make sure there is a barrier there. Sometimes taking a hot shower can help relieve those muscle spasms. We talked about massage. Sometimes you need to get somebody to help you with a deep tissue massage. Sometimes just massaging it yourself is good. Sometimes you need somebody to get in there with a deep tissue massage, release those muscles in there. Stay hydrated. Keep your electrolytes balanced appropriately, especially during the day, especially after exercise. If you're not drinking water, what do? You start drinking water. If you are drinking and then you start getting to the point of amount of water you need to take, you need to be drinking half your body weight in ounces of water a day. So if you weigh 100 pounds, then you need to drink 50 ounces of water a day, ideally. But if you're not drinking water, then start drinking water. That's step one. And that can be beneficial to help with these leg cramps, muscle spasms, Charlie horses. If you smoke, I'm going to recommend that you stop smoking. Smoking restricts and constricts our muscles and our organs. And it's going to be so much better if you do smoke, if you can stop smoking. That's going to be more beneficial for your body. So I've given you a lot of information tonight about Charlie horses, why they happen, how they happen, what are they, what medications cause them, what disease states cause them, what you can do to help eliminate them. And living a good, healthy life. Doing these little things, start drinking your water, getting enough sleep, practicing gratitude, meditation. These are all things that are part of Whole Body Health. And Whole Body Health is a program I put together that is a start to get you going or keep you on the right healthy journey. It's the first step of a baby step. And so I do want to make sure, I want to give you the opportunity to sign up for Whole Body Health. And Whole Body Health is, let me tell you where you can find it. So let me show you here. You can go to drmelissabalizan.com/TV. And I will show you this here so you can see it specifically. drmelissabalizan.com/TV. drmelissabalizan.com/TV. A special just for you. There's a Whole Body Health on there, and there's also another opportunity on there for you to get some information. So remember, you only have one life, one body. Take care of it now. This is Dr. Melissa, the Medicine Woman. Live a healthy, happy life. Enjoy your day.